様でした。終わってみて感想は？
We really liked presenting here. It was a very interactive Q&A afterwards. So it was really nice to learn more about the Japanese culture and the Japanese care for AYAs. And we hope to collaborate in the future.
I mean, I think Sylvie said it so succinctly, so we're just happy to be here. It was really wonderful to present. It's really lovely to see the passion for this really important topic in research here in Japan. And I hope this is the beginning of collaborations and learning together.
オランダでは、AYA の、年齢定義をどれぐらいっていうふうにしている？
Yeah, so in the Netherlands we define AYAs as those who are 18 till 29 years old at initial cancer diagnosis, and this is based on a dichotomized oncology care from origin. So pediatric patients are those who are younger than 18 years at diagnosis, and they are treated at the Prinses Maxima Center in Utrecht in the Netherlands, and everybody who's 18 years or older is considered adult. So the AYAs are considered 18 to 29 years old, and their care is integrated in the adult oncology in the Netherlands.
オランダのAYAがんは、オランダのすべての、がんのうち何割ぐらいを占めますか？
So in the Netherlands, they account for about 3.5% of all cancer diagnoses.
オランダではAYAがんの医療情報について、どのような入手方法がありますか？
It starts with the healthcare provider with whom they have a close link, and the AYA Young Cancer Care Network is one of the main providers of reliable care. So they integrate education, care, and research all in one. So it helps the healthcare providers, but it also helps the AYAs, and in turn the research initiatives and the outcomes thereof are being used and integrated to improve care and to improve the outcomes of AYAs. So it's like our learning healthcare system. So the healthcare network is the main delivery of information.
日本だと、がん情報サービスとか、JAMT がありますね。オランダでAYAがんの方が学校教育を受けるために何かサービスみたいなものはありますか？
Yeah, so I think what's important to remember in the Dutch context is that AYAs are 18 and older. So if we're talking about disruption to education, we're talking more about university level education. In that there isn't a set support system or official process that everyone needs to follow. It's really a case-by-case basis. Some students like to continue their studies, some discontinue for some time and then return. So it really depends. And then I think the biggest impact there might be things like financial. So I think, if I remember correctly, some of our municipalities may have some grants or benefits that people can apply for, but we know from research done by one of our colleagues that access to this sort of support is very difficult, and the lack of a very centralized or very clear way to access support can be frustrating for those students.
Yeah, I think it's for the AYAs themselves quite frustrating because they don't know where to find the information and the right care, but also healthcare providers also don't always know where to find the correct information. So they are both searching where to get the right input, and with the research initiative we want to learn how they would like to be supported, where do they want to get their information from, and how that should be integrated. So we hope with research to solve a lot of these problems because it's really relevant in the Netherlands.
オランダでAYAがんがすごく取り組みが待ってるんだっていう報告がさっきされてたけど、何がきっかけでそういうふうなことが始まりましたか？
Yeah. So in the Netherlands, you can't talk about AYA care without mentioning the name of our research group leader, Professor Winnet van der Graaf, both in kind of professional and personal experience brought her close to AYAs, I think, 20 years ago. And that really opened her eyes about the need for age-specific care in the Netherlands. So it was a kind of a combination of determination, passion, and years of hard work, talking to colleagues, meeting OHA as well, our other PI, to really get these initiatives off the ground. And I think that's common in a lot of countries. It takes one or two very passionate clinicians who see the impact a cancer diagnosis has on young people to start the ball rolling on these larger initiatives.
So, Professor Dr. Minette van der Graaf was like the founding mother, and then later on you had Dr. Eveline Mante, who continued to improve and develop the care, implement stuff. And for example, our other PI, Dr. Olga Husson, really made a lot of effort with research initiatives. So she was one of the first ones to receive AYA dedicated personal funding.
Maybe she's asking why the mother, the foundation. So she started the initiatives first of all.
So it's mostly related to her experiences, seeing AYAs in her own clinic, and seeing how much they are struggling with age-specific issues, which can be very different from the older patients that she was seeing. So that really made a lot of impact on her, and that started the first initiatives regarding AYA care.
医療者だったらもうみんなね何か思い浮かぶ患者さんたちっていうのがいて、その人たちのためにやっぱり医療者たちは頑張っているっていうのはやっぱりオランダも日本も一緒だなって。オランダのがん研究所のAYAチームはどういう職種で構成されていますか？
There are definitely doctors involved with different disciplines. So you have the treating doctor, there's an AYA dedicated nurse, but depending on the needs of the AYA, so per case, they can see who needs to be involved. So does the AYA need to be referred to a specific discipline, then that can be arranged. So we are talking about psychologists that can be included, social workers are most often already included, a sexuologist, for example, occupational physician. So we really try to include those disciplines that are needed based on the needs of the AYA. So make it very personalized.
全部で何十人ぐらい？
That's a good question.
Yeah. So we don't have the exact figures also because the NKI is both the hospital, so the NC Van Noordhoek, and of course researchers as well. So I mean, theoretically, if you want to talk about everyone involved in AYA, it would include our entire research group, even though we don't have patient access.
Yeah.
But in terms of patient care, there's one dedicated AYA nurse. And so she is the person who will see the patients to discuss the age-specific needs. And then it'll be the oncologists that are involved in the treatment. So depending on the diagnosis, that will dictate which medical or which clinical oncologists are involved. And then of course the other sorts of needs for your treatment, whether or not you need radiologists, surgeons, and these other experts. So I also don't think our psychologist, for example, in the hospital is AYA specific, but they will know that there are age-specific needs and they will be brought in when those needs need to be addressed.
So the nurse will be a navigator. So she's the
She's the kind of point of contact. Yeah.
日本もそうですね。オランダでAYAがんの人とか小児がんの人に対してその子供を産むとかセクシャリティなところについての相談体制っていうのは整っていますか？あと誰でも簡単に相談できるようなそういう雰囲気はある？
Yeah, there are fertility preservation options, and I think using the AYA anamnesis that we talked about during the presentation is also important to make sure there's communication about the needs of the AYA. Can also be future needs because we might be talking about a young AYA who might not feel any needs at that moment, but maybe in the future. So it's important that at least it's being discussed with each and all of them. There are definitely options. The one concern that there is that most often treatment has to start really quickly. So fertility preservation needs to be brought up really quickly as well, because if the treatment is started, sometimes it's in conflict. So it needs to be aligned in a very short notice. So both the healthcare provider as well as the AYA really make sure it's a topic of discussion at a very early time point.
for AYAs who are navigating intimacy in their relationships, there is referral to sexologists when those concerns arise as well.
The patients are comfortable with talking about their needs to the providers. How they're comfortable with that conversation.
It differs. For one AYA it's easier than the other one, but we hope that amongst others using the anamnesis that the threshold is really low and that people are being made aware of that it might be an issue on the longer term or in the future. So for some it is more difficult, but AYA Healthcare Network, for example, has developed modules for the healthcare providers, especially about topics like this, to learn how to better communicate about it, how to learn how to open up the conversation, start the conversation, and what is a good approach regarding these sensitive topics. So there are different ways and different tools they use and implement to enable the communication and to make sure the needs are being met of AYAs.
So there are modules like providers can watch and learn how to
Yes.
communicate about those sensitive issues, and then for patients, their materials they can access to as well.
Yeah, so the modules at this time point mostly used for healthcare providers, and they're still developing modules. So it's not a static thing, it's evolving. The healthcare providers can make use of the models, but they can also have a look at the anamnesis, which is all online available. But same goes for the patients. They can already fill in the anamnesis before they come to their appointment, for example. They can find online information on the website of the Care Network. But there are also other initiatives alongside the Care Network, which are evolving their information provision and trying to tailor and include specific parts on our website dedicated to AYAs. So you can see there's a trend of people that acknowledge the age-specific aspect, and they try to align their information provision with that need.
I can't speak as to whether or not this is common across all of the Dutch hospitals, but certainly people who come to the Amsterdam who might be getting a diagnosis or receiving their treatment, age-specific care guidelines and information is in the patient portal. Pre-diagnosis, actually, as soon as you are coming in for a test, that information is already available. So the age-specific needs is, it's already priority one, so patients get access to that information very, very early on.
Implementation of the AYA anamnesis and the electronic patient records is an ongoing process. So for some hospitals, it's already financed quite far, or they are quite far in the process. While others, there are different electronic record systems, so that's a barrier to tackle. But it's ongoing process. So you have the patient records, which is used by the hospital to enter all the information to get the treatments requested. But on the other side, the patient can have a look what's happening in certain parts of that record.
Now, part of the information is available for patients to look up their own.
Yes, just for that.
Yeah.
And then those age-specific guidelines may be included in those their patient-facing
Portal.
APR.
Yeah. So if the electronic patient records it shows that it's concerning an AYA, then there's an automatic, automation that says, okay, this patient should see the anamnesis and it should be discussed with the healthcare provider. It's like this automation based on the age. Yeah.
やっぱりがんというのが分かってから、それから卵子凍結とかいろいろしてると、やっぱりがん治療のタイミングを逃しちゃいけないとかいろいろあるから、やっぱり前もって情報にすぐアクセスできるっていうのはすごいなと思いましたね。オランダでドラッグラグとかドラッグロスの、問題は話題になりますか？
Yes, when you are reliant on a healthcare system that is dependent on insurance companies reimbursing treatment, cost considerations are I would say, one of the largest issues in terms of creating lag and access to certain things. I would say that that's maybe less of an age-specific concern, so less AYA only, and more of a rare cancer concern, just because of the cost of the drugs involved.
There are initiatives. There's one big initiative at our hospital that's tumor specific and not per se age specific, like Simone indicated already, to seek opportunities if treatments can be used in different ways for different types that are not very common combined. So there are definitely barriers to overcome, but I think the issue you're raising is, at least in our case at the moment, less age specific and more tumor specific.
最後になんかオランダにコロッケの自動販売機があるっていうふうに調べたのよ。本当？
Yes, yes, we have vending machine which have food in it, and it's all over the place.
Oh.
Yes,
Yeah.
It was a culture shock for Simone as well when
Yeah.
she came to the Netherlands.
Yeah, very strange.
ありがとう。最後にみんなでジャムティっていうの。はい、じゃあみんなでせーの、ジャムティ。はい、どうも
Thank you.
ありがとうございました。